First of all, prevent is key. Try to prevent this from even happening in your life. By doing that, you want to dress properly. Wear long sleeve shirts, long pants, tuck your pants into your socks. Wear light colored clothing because they'll be easy to detect on you. And wear enclosed shoes, no sandals like that if you're going to go hiking or anything like that. They're saying to use DEET to spray your clothes with, or any other insect repellent. Make sure you read the labels carefully, as you know, they can be damaging to your eyes or whatnot. And also know your facts about ticks. It can happen any time of the year. I actually just learned this last week where I thought wintertime, you're safe. They do live in the winter. They're persistent little bugs.
Even in the cold, they survive.
Cold, they can survive. When you are out, avoid edges of the woods, wood piles, under leaves. They need moisture to survive, so try to avoid those areas where, you know, moisture lies, the wetlands and, you know, things like that. Also avoid brushing against vegetation. They love to kind of hang out in the bushes, and even if you're just walking by, they can. The second thing I have on here is prevent is the first one, and then inspect.
Okay.
What you were talking about before, once you are outdoors, when you come inside, a large percentage of the people that do dress properly, do all the right things, have the DEET, long clothes, tuck their socks, they're more likely actually to contract Lyme disease because they feel as though they're protected and almost invincible, and okay, I'll go check this area out. And also less likely to check when they come inside.
Right.
They're such little tiny little bugs that they can crawl in that sock. You know, they can get, like we were saying, brush across vegetation, and you know, obviously you're not going to go out in an astronaut suit, and I don't want anyone to feel as though they can't go and enjoy the outdoors. But make sure, even though you're dressed properly, to just really check. And that's your entire body check too. Ticks love to hide in dark places, dark, moist areas of the body. Example, under your arms, behind your ears, crevices in the body, such as mine where it was behind the knee. Again, that moisture. Have another person check your back. That's not always something we're going to see in the shower, so you want to make sure somebody just checks your back. When you do take a shower or a bath, make sure you use a washcloth to dislodge, you know, maybe one that is, you know, trying to attach itself. And we already talked about the painless bite of it not being, you know, equal to a bee sting.
Now, what about like in your hair? Like, you know, my daughter has long hair.
They recommend that if you do go outside, that you tie your hair back. Again, you know, you're just eliminating somewhere where they could catch on to her hair, and you know, they won't do it at the time, but they'll just kind of travel around until they find. Now they can
get into your scalp, though, right? And
they can get into your scalp.
It seems like that's the really hard, because in your, you know, the hair is covering. You would never know that it was there.
You wouldn't know that it was there, and again, it's just going to be kind of one of those, oh, it feels funny, and then actually someone looking there and saying, geez, yep, there he is, you know. It's tough. We'll talk a little bit about reacting once you do see him on your body. If a tick is just crawling on you, like you said, if you're outdoors, it's okay to brush him off. Make sure, you know, keep in mind, if you're inside and you see him, obviously you're not going to brush him off because you're giving him a second chance. You're going to kind of let him hang out on the floor until he can catch his next victim. The engorged ticks, where he is attached to your skin, first thing that you want to do is tell someone. It's best to seek medical attention, like we talked about before, and not to be that scientist or that specialist, you know, seek professionalism. Now,
should anybody try and remove a tick? I guess that's the question. Because the first thing, you don't want it on you, so the first thing you do is pull it off.
Your first reaction is to try
get it off, right?
And avoid that if you can. The removal is tricky. They say do not grasp them, squeeze them, or twist the body of a tick. Again, when you do that, you go to remove him. The minute you squeeze him in your upper body, he's going to regurgitate that bacteria into your skin because he's being, you know, fought with. So
trying to stay in. Right?
Exactly. He's trying to stay in there, so he's going to regurgitate. Their best form of removal is trying to get as close to the head as you can with the skin. Where he's embedded, try to get right where with the tweezers. Do not rub Vaseline on him. Do not burn the tick off. There's so many different theories of...
And I've heard of these too.
Yes.
People trying to burn and suffocate it with Vaseline.
Suffocate it, like I said, the best thing I would do even today, I would just go right to my physician.
And they have obviously they have a way to safely remove it without...
They're knowledgeable.
And probably, and like you said, they actually need the tick to send to the lab.
Absolutely.
So it's better that you keep it on almost. I know it sounds...
it sounds a little
uncomfortable,
creepy.
but it's probably better.
Even local emergency rooms, they're good at it.
Okay.
I know my husband Sam had one. We went right over to the emergency room. And the benefit also of that is not only are they going to remove the tick safely, but they will start that doxycycline right away. That's your trick. It's not, get him out of your body. And again, the removal being tricky, you don't want to leave pieces in there, cause infection, where it's going to bother you later on. So, like I said, just get medical attention. All of those methods that we talked about of the Vaseline and the burning them off, simply increasing the likelihood of transmitting the infection. So, demand testing.
Okay.
And treatment. Demand it. A lot of doctors are not knowledgeable. I'm not going to totally knock the medical profession. A lot of doctors are aware of what's going on. So, but if you have that option, do you want to do the doxycycline? Absolutely. You got bit before and you kind of had an option. Well, they're leery of giving an antibiotic, which is understandable.
Right.
But if you get 2 doses even of the doxycycline right away and you try to catch it before it goes into them, oftentimes what they'll say to you is, why don't you wait and see if some symptoms develop? Bad advice. By the time those symptoms develop and you can get into a different stage of the Lyme's, it can already have been attacking your central nervous system. Okay. And depending on your immune system, and everyone is individual, it can attack immediately. So oftentimes it goes after your heart or organs. People have difficulties with the central nervous system as well.
So if you take the antibiotic, it doesn't necessarily do any harm to you. It's just kind of a precaution, just in case. Okay, and you mentioned stages now. You said there's different stages.
There are different stages. In the earlier stages, obviously, it's easier to treat. Here's what the CDC, believes. This is their guidelines. You get bit by the tick, you get treated immediately. Lyme disease is gone. I want to say first that with Lyme disease, it's the second great imitator. When I asked somebody what the first imitator was, I don't know, honestly. Plus the inaccuracies and failures of Lyme and tick-borne diseases, they're misdiagnosed, often mistaken for MS, ALS, lupus, because they have a lot of the same symptoms. And again, just from process of elimination to avoid any misdiagnosis. On the onset of Lyme disease, symptoms, they can be easily overlooked. Once the symptoms are more evident, like I said, it could already be in your system and attacking the central nervous system. For the diagnosis itself, one of the requirements, they say that the tick needs to be on you for 24 hours in order for that to be infected. Not necessarily true, because if you go back to what I had said before, he could be just embedded in you. He could have just attached himself. But like I said, the minute you go to remove him, he's going to release that bacteria. Symptoms, again, sometimes, but not always. The bullseye rash, like we talked about. Bell's palsy is a very common, if you've ever seen someone with Bell's palsy, almost looks like a stroke victim, where again it goes after that central nervous system, and you'll notice a droopiness on one side of the face. On the one side of the face. Can last, it's been known to last for 6 months to a year. Arthritis is typical. Some may experience the fatigue, the headaches, the anxiety. Keep in mind, early detection, early treatment, early recovery.
And it's not necessarily that bullseye. You're not going to see it all the time.
Not necessarily.
Okay, so that's not the determining factor.
No, it's not.